Before I started with palliative care, I really didn't do that much. It just seemed like every time I went in the hospital, I'd come out. 2 weeks later, I feel just as bad as I did before.
I had a serious illness. I ended up in the hospital for a month. When I got out of the hospital, I was a little nervous because I didn't know if I was going to be able to function by myself. And that's when Palliative Care showed up.
Palliative care is managing complex symptoms in patients with life-limiting illnesses. We like referrals to palliative care to happen as soon as a patient is diagnosed with a serious illness. That gives us time to have really in-depth discussions about goals of care and allow the patient to learn more about the progression of their illness, when to seek help, and when we can provide more help down the road.
What I find is that patients who are concerned about how their condition affects their family, how they're able to continue with the life they had prior to this medical condition, or simply needing to make better decisions about how to deal with their condition, I know that they're the type of patient who may benefit from having a palliative care team involved in their care.
Our palliative care team includes physicians and advanced practice nurses that specialize in palliative care. We also have social workers and chaplains.
Coming into the home, we really are their care coordinator. We're able to communicate with all the different members of the team, get everyone on the same page that align with what the patient's goals are.
Patients are better able to control their symptoms because the palliative care team has given them a regimen to reduce ER visits.
Good.
The information that they were giving me and stuff was helping me build up my confidence where I could get outside, and I've been able to do more.
That's pretty amazing, actually.
Yes. When you're sick and you're weak, you focus on things that you can't do. They make you feel comfortable with yourself again.
So how are you feeling?
We really function like a life coach. We listen to what they have to say, and we use that as a foundation from which we can help them make better decisions about the care they're going to receive.
Palliative care can be provided really at any age and at any stage of a serious illness. As their disease progresses, we can continue to layer in extra care to make them comfortable and help them live the best quality of life that they can.
I think they've really turned my life around.
I have gained strength, and I feel that I am stronger than I was before I went into the hospital.
It's not just the patient who benefits, it's sometimes the families. I've had multiple examples of families who have come to me after they've interacted with the palliative care professionals and have found that they really have gotten their lives back. They actually feel much better about the understanding of the medical conditions, as well as having more time to do the things that they need to do in their own personal lives.
Just recently we went up to the Dells, and we have 7 grandchildren. I was able to walk with them quite a bit, more than I thought I would. Got to spend some quality time with all the grandkids.
When you have your health, it's everything, because without that, you don't get to go out and enjoy the things that everybody else does. You get to sit and be a spectator, and I don't want to be a spectator, I want to be a participant.